Recording.
Right. So make sure that you get proper writing tools. You don't need anything fancy, but when it is that you're doing your labels, you want to try to make them as waterproof as possible. Simply because things disintegrate over time, wear and tear, if you're touching it a lot. These fancy labels could work, but waterproof them. These look like thermal labels. So usually when you touch it over time, it's gonna flake. So this is why I would recommend just doing your label. You can put contact paper over it, so it's intact, it's waterproof, you can handle it, you can touch it, pick up the jar, put it back down. Um, so this is usually a good thing. Make sure and see, okay, if it is that this is a fresh harvest, note it in your notebook that you did the dehydration yourself. Write it down when you bottle it so you know how long it is that you have to use it. Now, one of the things is if you buy herbs from other people, one of my major concerns is always how long is my shelf life gonna be? Because I don't know how when this person harvested it, I don't know how long it would have sit in their storage or sit in transit or sit in the person's place where I bought it from. So this is why you need to know where you are sourcing your herbs from. Obviously, the best is always growing it yourself, but if you can't access it, because what happens is that when it dehydrates, even though it removes the moisture and stuff, it's still a living thing. It's still considered part of a living thing and it would degenerate and become a powder. So the length of time that you have it is determining on all of these factors. And oftentimes you might buy a tea and then it starts to disintegrate really quickly. So it means that this was probably there for so long before it reached you. So ingredients. Um, I talked about the purchase, cut and cultivated. So cultivated means you grow it for yourself, or you can purchase it for organic farmer. So it has a guy that I buy from locally. He asked me what I want him to grow, and he will grow it for me. I will purchase it, dehydrate it, and I will have it. It's so that way I know how he grows it. I go to his setup, I see it, I see how he treats his workers, I see how his operations are. And if it is that I set a very high standard for myself, because I do have an apothecary. You would have seen it, this where the school was advertised, Izuli Apothecary. Um, so for me and my for personally, I need to know where my herbs are coming from. Now, wild crafted or harvested means that you got it from the wild. It's grown seasonally, you harvest accordingly, you harvest, you don't over harvest to the point that you compromise the longevity of the plants. You take just enough that the plants could grow back for themselves. Now, if you're wildcrafting, normally you don't root out the plant, you just take what you need from the plant and then the plant will grow back um accordingly. Now, if it's in a case where you do need the roots, you do need the tree, and you do need the leaves, that is absolutely fine. You just need to make sure that you put things back to grow. Now, the difference between wildcrafted and cultivated is that this would be more than likely come from a seed or a strain of the plant that is best suited to Trinidad or whichever climate. So in this case, rosemary grows in a very dry, sandy soil, right? So you don't want to put it in a place where it's going to collect a lot of rain. It's not going to get a lot of sunlight. It's going to be very wet and moist. You don't want that. Now, wildcrafted means it's out there in the wild. You don't control the conditions. Now, if the conditions are favorable, the plant will thrive, and if it is not, the plant will die. Okay, so sea moss, you would see oftentimes the ingredients, they will say wild crafted or wild harvested. You would see, I think St. Augustine sea moss. Oh, sorry, it's Toko sea moss. Sorry, not St. Augustine. They post on their social media when they actually go along the coast and you see them pulling the sea moss from the oceans, or if it is like off the side of the cliffs, you actually see them harvesting it. So then you can say, oh, well, this is local people and they do their thing, and then maybe okay, this is good quality things. Um, yeah. Okay, so ingredients. We use honey. So the liquid that you use for your herbal preparation is something called a menstruum. So honey can be infused with herbs, florals, berries, anything. And oftentimes people will do garlic and lemon and honey for people who have colds and flus and these kinds of things. Here we have the dried herb. And then we have here apple cider vinegar. Here we have the tincture. So tincture uses alcohol as its liquid. Usually it's 90% proof and up. Puncheon has 75% and some vodkas have 80%. So the higher proof that you could get, the better. However, like I said, it must be within your budget as well. So if you can't afford the 90 and something that is less that you can within your budget, don't really put yourself in debt for that. Now, if it is that you cannot have alcohol for religious purposes, or if it's going to be administered to somebody who is a known alcoholic or somebody who has issues with consuming alcohol, who have low tolerance for alcohol, who are children, um, who are neurodivergent, the elderly, you don't want to give them alcohol. There's glycerin. Glycerin usually comes from a vegetable. It's clear, it's sweet, and it can do the job. Oftentimes, glycerin is used for fresh preparations. If it is you're using fresh herbs, they both have their merits in that the alcohol can break down both alcohol soluble compounds and water soluble compounds. However, the glycerin will only take water soluble compounds. So the glycerin will do like fresh and dried. However, the alcohol can break down tough plant materials like roots, bark, seeds. So it might be a better extracting agent depending on your plant part that you're using. So this is just another example of the ingredients used for preparations. So your different types of herbs that you would use is for sleep and relaxation, digestive issues, calming, immune system, nausea, and respiratory system. Sorry, respiratory issues. Okay, so we talked about drying, but we need to talk about storing as well. So if it is that you store things in airtight glass jars, we talked about the dark bottles specifically. You can freeze things as well if you have the freezer space. You can also do freeze drying, in which you, instead of putting it in the freezer afterwards, that is a dehydration system where it basically crystallizes your materials and you're able to store it at room temperature. So an example of this would be Nescafe or the instant coffee, where they would have these crystals and then you're going to use room temperature water to dissolve it, and then you're going to warm it up. So that way it's not as bitter and pungent. So what freezing does, usually this is good for like fruits and vegetables as well. It freezes it at its best nutritional state, if it is that is where you did the harvest. And it means that when you dehydrate this, I mean, sorry, defrost this frozen thing, it's still going to be as nutritious as the day that you froze it. So somebody's mic is uh audio's on. Please take it off. Okay. So here, however, there's a limitation to There's a limitation to freezing in that you need to have a freezer, the freezing space, and then the electricity that's going to be pulled for freezing. And then what happens if it is that that electricity goes and your freezer is compromised? Now, using a mention that we mentioned before, you can have access, extracts sitting in your shelf for many years. Usually alcohol tends to go for several years, glycerin for less, vinegar for like a few months. So we covered all of this in session 2 and 3. Right. So safety considerations, make sure and do your research. So this is where we're going to talk about Materia Medica and Herbal Monograph, because your research is going to fall into this template or document that's going to answer all the questions that you need to ask. Now, when you're doing dosage, always start very small and work your way up just to see if there's any allergic reaction or anything, whether it's a topical application or oral application. Always, always, always do a test. Now, make sure hygienic practices are followed. If it is you can't wear gloves, that's absolutely fine. Hand washing is is always an option. Make sure and wash. Sanitize the area. No, we talked about sterilization and sanitation in session 2, so I will not go into details about it. I'm just going to mention it because it keeps your area clean and you get less of a compromised area. There's less contamination happening. There is less bacterial growth, microbial growth, fungi growth. And then obviously you need to have proper storage to make sure that you don't have contamination, spoilage. Make sure and cover your lids properly. So I want to talk about the Materia Medica. So basically, this is where all your information is going to be found. So here we'll have your name and the classification. So this is usually the scientific name. The scientific name is usually 2 words. That is your family and genus. If I'm not mistaken, it's always in Latin. And the reason why we want to have the scientific name is that in Trinidad, we call Coraili. Some people might call it bitter melon. Somewhere else, they might call it something else. So knowing the scientific name of it means that it can be recognized internationally. So for example, I was working on a document for next week's class, and there was a distinction between purple tulsi and wild tulsi. And, the family would have been the same, the genus might have been similar, but the physical, how they look, is totally different, right? So again, I wanted to make sure that it was the correct thing. And one of the ways of it is scientific. So I think they gave me Coraili. I was like researching Coraili, and I got so many variant names for it, but I had to check the scientific name to make sure that yes, this is Coraili. Yes, we can go ahead with this. So that is very important, right? And then type of substance means what it is used, like what is the main biological component that is used. So for example, turmeric, we know curcumin is like the active ingredient that is used for that immunology boosting benefit that we want from turmeric, right? Now, description. So you need physical and botanical characteristics. Luckily, we have the internet and we can Google it. Back in the day, you needed to know it. You needed to draw it. because people need to look at your drawing and look at what they're seeing in real life and be able to say that, yes, this is the plant. Habitat and distribution. This is where the plant is grown. So, for example, aloe vera grows in Trinidad and Tobago, but it also grows in other parts of the world. So you want to know where it is native to and where it can grow and what areas that supports it. Now, aloe vera that grows here in Trinidad might be totally different from an aloe vera that grows in a desert area. So, these are things that might cause slight variations in what medicinal properties that plant is able to give you. So, preparation and dosage. So, I'm using aloe vera as an example. So, the preparation from the aloe vera can be using the gel or the latex, which are substances that you use for herbal remedies. And how it's used depends on the preparation. Are you making a face mask? Are you putting it in food like in a smoothie? Are you using it for topical application because you want to promote wound healing? Whatever it is, and then what is the recommended dosage? Now the therapeutic uses will be how you're going about to use it to treat it. So you would see, okay, if this person has these symptoms, maybe it's going to work. Pharmacology and mechanisms has to do with the biological component of it. So usually this takes a little more in-depth research to find what the mechanism of action is for a specific herb and how it works, what indicates it, what works against it, what works in harmony and synergisty with it. So that's important things to know. And obviously side effects. You need to know what potential side effects are going to happen. Where if it is that, is it worth the risk? Is it not worth the risk? So you are now able to make that assessment. So here are some modern examples of the materia medica that you can Google and find it. And your homework would be to make one for yourself. So here, your homework would be choosing a plant, doing the research. So you're going to get a notebook and you're going to stick drawings in if you feel comfortable drawing it, especially if it is you have the plant in your yard, you go outside, you draw it, you can stick pictures of it, you can create it. Somebody can, if it is that you make tea, try making a tea, cook it in food, see how it tastes. So one of my favorite things is I like broadleaf thyme. So I tend to use it for everything. I put it in cheese paste. I love cheese paste with pimento and broadleaf thyme. It has a lot of health benefits. I put it in meat. It goes really well with meat. Sometimes I make tea with it. If it is, I am doing one of those immune boosting tea. So oftentimes if somebody's sick, I'm usually the person that would just make them this concoction and give it to them. That's my part in helping you, recover. So what does it taste like? What does it smell like? Is it bitter? Is it pungent? What reaction do you get? Is it something that is going to be comforting to you that you will want to use it when you're miserable? Does it make you more miserable that you don't want to use it? Just write something that you discover with it. Now, normally, one of the tenets of herbal medicine is that when you have to study herbs, usually it's like one herb a month. Yeah. And you have to basically do this. You have a relationship with the herb, you grow it and, see how it comes up and what type of, is it like a sun plant, a lunar plant? Does it bloom flowers? What type of seeds it have? So usually when you have this connection with the plant, you're better able to understand the plant and then you know how the plant works and what substitutes you could do. And then oftentimes when somebody is telling you their ailments, you already know based on what they're telling you and your information from this herb, what it is that you can help them with. So this is how, people learn a lot of herbs. And oftentimes you would see a lot of them have similar mechanisms that they do almost the same thing, but you may not be able to substitute for some reason or the other. Okay, so a herbal monograph now is a bit more official. It's a bit more scientific. It's more has clinical appearance. We consider this to be a little more a more serious document because it's detailed, it's comprehensive, it's not by the way information. It is a lot, right? And it doesn't really happen like the research period is not a short period at all. Now they standardize the format, they have a much of the information as possible so that you can be able to understand it. So it goes into clinical research, safety and precautions, modern and traditional uses, preparation, and dosage. Now, preparation, you don't really cover much of that in Materia Medica. It's just understanding how the herbs work. But with the herbal monograph, it tells you what types of preparations that you could make. So, for example, lavender could be made into tea. It could be made into any herbal preparations, included essential oils that can be used for aromatherapy sessions, right? Rosemary is really good for circulation and for regeneration, for growth, for brain health, for regenerating like the hair follicles, for your hair growth, for skin regeneration. It's so high in all of these compounds that has regenerative properties, but it's very bitter to drink. So oftentimes people might just get rosemary oil and have a topical application for what they needed. However, drinking it in a tea has more benefit than just a topical application, because a topical application, remember, we have our skin barrier, and depending on the carrier oil that you use, that carrier oil can go so far into your skin. So there's a lot of limitations as well. So drinking your rosemary tea first thing in the morning is a good tea to drink, especially if you're studying, if you want brain to boost your brain health, if you want to good circulation, if you know you have circulation issues, especially like men, their male health is linked to circulation. So anything that's good for circulation is good for male health. And usually you have a lot of issues happening and they don't take into consideration what is being stagnant in that system. And men may be taking if you have a heart attack, if you have any ailments and you're on different medications, oftentimes these medications end up giving you a undesired effect when it comes to performance. And now you have, okay, so what can I use that's going to bypass this? Cinnamon is really good for blood circulation as well. Clove is really good for blood circulation. Cinnamon is a good regulator of blood sugar as well. So knowing how these things work, you could now ask yourself, what is the best option for this patient? Now, you will not give rosemary to a pregnant woman or somebody who wants to get pregnant because rosemary is abortive. Cinnamon is, so for people who have PCOS, cinnamon, high dosage of cinnamon is part of the treatment plan. Once the patient decides that they want to get pregnant, well, I'm gonna have to say clients. I'm sorry, I can't use patients. Patients is for medicals, right? For actual medical MD doctors. So we have certain terminology that we have to use in herbal medicine. So clients, if you have PCOS and you want to get pregnant, there are two things that there are things from that treatment plan that you don't have. So like you don't take rosemary because it's abortive. You don't take cinnamon because it's abortive. You reduce the amount of probiotics that you take because you don't want to harm the fetus. And now your child will be feeding from you through this blood barrier. So there are a lot of things that you don't do, which is why when you're pregnant, 100% of the times we say don't take any herbal medicine. Each pregnancy is different, so what worked in the last pregnancy might not work, and always take care of yourself, right? Because when it comes down to it, your body does not protect the fetus first, which is why miscarriages happen. And your body will do fetus deletus and try to get rid of it if there's causing any harm to the parent, right? Which is why it's important to really get as much information as you can, and which is really important in reading the herbal monographs and the materia medica and stuff, because it really goes into all of these things at a deeper level than your materia medica. So materia medica is just an overview of information that you can pluck and you can use in a snap. But when you have more serious issues to deal with that needs more in-depth information, this is what you have, a herbal monograph. So you see, it's used for herbalists, researchers, healthcare providers, and anyone needing detailed information about a specific herb. So this is so like somebody who wants to do IVF, and they're accustomed drinking like herbal teas or any of these things. You don't want to put your stuff at risk because you're putting all this money into getting pregnant. So why would you, compromise all that hard work? So this is the herbal monograph. And for people who want more detailed information, this is very important. And for people from session 2, I hope you can see now the benefit of doing session 1 and going through the materia medica and the herbal monograph, because this is going to help you with your preparations, the type of preparations that you're able to make, the limitations that you have with each type of preparation, and administering it. So here we have, right, the materia medica, it focuses on a smaller, it's broader in scope, but it has a wider range of medicinal agents. So in this case, it's not as detailed and as specific, I should say, as your herbal monographs. Okay, so we went through the materia medica previously. So it's just right. So here we have it's exhaustive information for your herbal monograph, whereas the materia medica is an overview. The content that it contains, it's usually different, where it's similar but different at the same time, and how it's used. So we went through this. And y'all can read through this in your own timing. Actually, we do have some time, right? Yeah, we do. So basically, we have here what we would look at for the St. John worts. So this Hypericum foratum supposed to be in italics. I do apologize. I would try to remember to fix it before I upload it. So all scientific names must be in italics. So here in your herbal monograph, it's going to have your detailed botanical description, chemical constituents, extensive therapeutic usage, how it's prepared, dosage, etc. So you see everything aligns with what we went through in that template. And then here it's going to have more overview information between of that materia medica. So I wanted to show you guys like what an old-timey materia medica is. And I think it was really nice to look at and see people's artwork, how they draw it. So here you see this would have been painted and hand drawn. You see the roots, you see what it looks like, you see that it has thorns, you see the size of the leaves, you can see the shape and the lines, you can even see the jagged edges of the leaves, the type of seeds or berries that it may have, and the flowers. So this is why, having a materia medica is very, very important. So here is another example of that materia medica, and here they have it as a record. So like, guys, y'all can go if you're willing to go past 3. If it is that we have a lot of questions, let me know. If you can't, that's absolutely fine. The recordings will be uploaded and you'll have access to it. So they would have kept this information in drawers, like library cards. Yeah, so here you can see different drawings of it. So this one has the plants. So you see that the leaves are a bit feathery. It has closed bulbs. These bulbs, these looks like dandelions. Sorry, not dandelions. Those are easily dispersed and you just flowers that you just blow on and it goes all over. And then these are like the closed versions of it. Uh, back back in the day, people used to like paint as well their illustrations. So they would have gotten very detailed paintings that you can now use and look at. Thankfully, we have the internet, so we could literally just Google St. John's wort, yeah, plant, and now you see it. You see what it looks like. So you see that the plant has these filaments in the flowers. You see that it's a specific color flowers. It has this fruiting body. You look at the leaves, you see the shape of the leaves. They're very long. So, we thankfully we have the internet, so we have a better visual aid. We also have lots of videos that you can access, if you need to. So you click on it, you get it. There is like I said, we have the convenience of the internet. So here I wanted to go through the template. So there's a template that I included here in the creating a Materia Medica document. So here you have your template and you substitute it with the information that you need. So here now it talks about the individual entries, the review, the format, publishing and distributing and updating regularly. So here would be the actual template of aloe vera. So I have the description, so I have the scientific name, common name, the family name, the description, where it's grown, preparation, etc., and side effects. So there's a different side effects in terms of topical application if you have it internally and what contraindications is going to happen. Now here is the same thing. This is a little more in-depth because it's a in-depth document compared to the Materia Medica. So here we have an aloe vera, an example of an aloe vera herbal monograph, and you can see that the information is a bit more intensive. Like there's more to it than just an overview information. So they actually talk about, the teeth are on the edge of the leaf, the rosette pattern for the plants, what it looks, where the gel is located, where the latex is located, the color of the gel, the color of the latex. So here we have the parts used and the chemical constitution. So everything is here, right? It even goes into your pharmacology to help you understand how the plant works and additional information. This is another example. This is the herbal monograph for St. George's wort. Right, and now here, how do you go about selecting and researching a herb? Now, this is additional information. Read it through in your own time and you go about. So here I have, excuse me, textbooks that you can use, online databases, and then you can actually visit UE Herbaria. Sorry. That's the only herbarium that I know in Trinidad. To make your life easier, you can give them a call, ask the questions. Here, same thing, accessing the information, certain information, everything is there. So hopefully, I know this is a very intensive document. Your homework is not to do this, but the Materia Medica instead. So that's the end of our class. Let me know if you have any questions. We have a few minutes, like we have 15 minutes on the for the class to end, but we have like 5 minutes on a timer. So if you don't have any questions, you don't need to come back in. We'll end class. If you have questions, y'all could come back in. Okay, yes, Safari, you can go ahead.
Yeah, quickly, I would have signed up for next week's session, which is, I believe, session 3.
Okay,
But I didn't get a WhatsApp from you confirming. I'm not sure if you would have missed
so
my registration.
no, I didn't.
Right, okay.
Usually, the week before the class, I would message because
Uh,
a lot of people either forget that there's a class or they have clashing times. So I would usually wait for the last week to message. So more than likely Monday come in, not tomorrow. Sorry, not sorry. This Monday, sorry. Hear me? Not tomorrow. Oh my goodness.
it'll be this Monday.
Tomorrow. Yeah, tomorrow I would have messaged you. So tomorrow I would, yeah.
Okay, thank you. The class was very informative. Thank you very much. I learned a lot.
No problem. Okay, so before y'all go, so I hate to do this to you guys, but unfortunately, if I'm giving you a certificate of participation, I would like to know that you understand the work. Now, this quiz is not definitive of anything. It's not being marked, even though I said it's 5 marks. I just want to see how y'all answer it, right? So basically, I just want to see if it is that certain topics I'm teaching it well enough that you can explain it to me back, or if I need to work on it in certain areas. So when you click on it, there are different sections. So here, you would just give me your information, and then you go on to the different sections of the quiz. Hold on a second. Let me see if I can access it. Um, Live. Okay, so this is your quiz. So my view of the quiz is going to be different, right? So basically, it's separated into sections. So what happens is that as you go through each section, it basically you have an answer. Even though I say 5 marks, usually it means I want some details. I don't just want to overview. I kind of want like 5 sentences. So that's why I say 5 marks. But it's not going to be posted to the rest of the class. This remains between me and you will still get your certificate. It's just that I want to make sure that you give me a response before I give you the certificate. So it goes through everything that we did, and I want to make sure that you're able to understand properly what these things are. So then you could look at the course outline and say, hi, I understand this clearly. I am great with this. Some people might be shy to ask questions. So y'all can send it to me privately. We do have a community WhatsApp group. So those of you who want to be part of the community WhatsApp group, message me if you're not already part of it, and I will add you to it. The class WhatsApp group is only valid for this week for people who want to share information based on the class, ask any questions, or if there's anything that I want to share with you extra, and we'll post it in this group, this WhatsApp group that you've been added to. By Saturday, y'all can make sure and save all these information, send it to yourself if you need to. I will delete it, and all correspondence will continue in the community group. So people from session 2, session 3 will answer your questions if you have any. Because this is where all the students who want to come into this group will come. Any more questions?
How many questions is the quiz? Is it up to 14
Um,
or 15?
16.
Oh, 16. Okay.
Yeah. Mhm. And if y'all want to send me a little review that I could post on my social media, no, I would really like it because my Facebook page for Zulia Apothecary was compromised, and now I'm making a new San Giovanni page. So I would like to post the reviews on it so people don't think my school is a scam. So I want to add some legitimacy to it.